Welcome. We're going to go over the COPD case study and many of the problems that several of you had. Okay, guidelines for all assignments. There was a guideline posted with this assignment. Many did not read this. And how do I know this? Because the naming of the document is number one. You're supposed to name the document with your last name as the first word in the file name. Most of you missed that this patient was experiencing a COPD exacerbation. And this is the definition given by the GOLD guidelines. It's an acute event characterized by worsening of a patient's respiratory symptoms that is beyond normal day-to-day variations and leads to a change in medication. So this happens over a few hours to a few days, not many days to weeks to months. It's an acute change in one or more of the cough increases in frequency and severity, the sputum production increases in volume or changes character, or dyspnea increases. On our patient, for sure the dyspnea increased. The sputum production, it does talk about it being thick and gray. You don't know if that's a change or not. And I don't believe it said the cough increase. It just said he was coughing. But he is having an exacerbation. Here's a slide in your lecture on management of exacerbation. So bronchodilators. So most of you gave the patient a LABA/LAMA, which is the right thing to do. But the patient should have also had corticosteroids and antibiotics. I'll talk to you a little bit about corticosteroids here in the next slide, I guess. So, oral prednisone for COPD exacerbation. It was in the article assigned from Up to Date. Up to Date says 40 milligrams for 5 days. And many of you got that if you figured out they had an exacerbation. But the problem is it's not available in a 40 milligram tablet. So you have to look at dosage forms in the US. So when you go to the drug in Up to Date, which is sponsored by Lexicomp, you'll see dosage forms US. And this is the one that I copied from the prednisone. And it's got tablet oral. It comes in 1, 2.5, 5, 10, 20s, and 50s. So you got to give them 2 20s. So you should be able to look on Up to Date and find out the dosage forms that's available in the US. And it may be different in other countries. Here's another one. Here's the Combivent Respimat. The dosage forms in the US. Solution for nebulization. Okay, got that. Solution for oral inhalation, which is only available as the Combivent Respimat. So it is not generic. If you look at here, generic equivalent available in US, yes, solution for nebulization, not the solution for oral inhalation spray. Now just so you know, nebulization, it's when they put them in that's what you see in the hospital when they have the mask and the little nebulizer treatments. That's a nebulization. This is the summary of the different groups. This patient was definitely group D. So with further exacerbations, he should be on a LAMA/LABA. And then when he came back, you could have put him on a LABA/ICS. There are a couple other options, I should say a LABA/LAMA/ICS. But there's a couple other options that you could do. You could have done the prednisone at the first option because Up to Date does say the antibiotics should only be given if there's purulent sputum. Well, thick gray sputum, is that purulent or not? So you could have left that, could have given him prednisone, oral prednisone, and then left the antibiotics for the next follow-up if you wanted. Now I would give antibiotics. The thick sputum and the increased sputum is just a breeding ground for bacteria. So even though he does not have pneumonia now, he may be getting colonized with it as we speak and will end up with pneumonia. So you're much better off trying to thwart the growth in the beginning. Okay, patient education. The old guidelines said patient education includes pharmacologic and non-pharmacologic interventions for the disease or conditions in detail. So I thought you guys would know what non-pharmacological interventions would be, and apparently I need to be more specific. So I'm changing the directions to include the first statement and then the examples, which I think I already did the low fat diet or something. But the disease process needs to be explained, including non pharmacological interventions such as diet and exercise. Vaccines, I think that's really pharmacological, but you still need to advise them on that. Age and risk factor appropriate screening, etc. So, for this patient, she needs to know her that her disease is progressive. There are interventions that could have helped her with her dyspnea, such as, let's see, um, avoiding high humidity. So using vents in the bathroom, taking warm showers instead of hot showers, avoiding fumes and vapors, um, keeping the home well ventilated, sitting up while sleeping, um, just lots of different things like that. Um, Diet, there's specific diet for COPD. Um, Increasing fluids will help thin the secretions. Decreasing carbohydrates will decrease the CO2 that's produced. Um, Short, I should say, small, frequent meals. She still needs exercise, whether or not she's short of breath or not. So, pulmonary rehab for 12 weeks. Her vaccines needed to be pneumococcal, and you needed to be specific on which one should have gotten first or second, because we have the PSV 13 and the Pneumovax 23, so those both need to be done. The influenza vaccine, she needed lung cancer screening, lipid screening, blood pressure, breast cancer, colon cancer screening, etc. Yeah, obviously not going to be done during an exacerbation, but this all needs to go under patient education. You need to stop her over-the-counter medications. I think she was on Primatene Mist and Robitussin, so those need to go. The tiotropium that she was on needs to be stopped if you're going to put her on another LABA LAMA combination. And don't forget that 2 maintenance inhalers are much more expensive than one combination inhaler. So the tiotropium should have been stopped and she should have been put on something else that was a combination. Okay, now we're into the prescriptions. Here's one for a Noral Ellipta, which is a LABA-LAMA combination. So this one's ordering it as a brand name. It's not available generic, and I usually order them by brand. You could have just put a Noral Ellipta inhaler on top here. I like to put the dosages next to it. There are some inhalers that come in different dosages. So it's kind of nice to know which are which. This one only comes in one dosage. So take one inhalation once daily. I prefer you use inhalation rather than puffs because puffs sounds like you're blowing and you're really inhaling. So let's use the inhalation. And it's ordered by one inhaler, not the number of inhalations. Sometimes if it's a dry powder inhaler, you can order it by the inhalations, but it's just easier. It comes in an inhaler. So that's it. This one was refilled. Generic substitution. This isn't available as a generic, and you ordered it as a brand name, so leave it blank. Child-proof container, just leave it blank. No inhalers come in child-proof containers. And by the way, they're not child-proof, they're child-resistant, just so FYI. The child-proof containers are really only for capsules or tablets. The one anything that comes with a top, a cap. Here's the same drug, the Onoral Ellipta, but ordered by the generic names and that are in the inhaler. So some people would put Onoral Ellipta and put the generic information in too. So don't order both as a generic and a brand name, either one or the other. So this one here, we're ordering it generically, but remember it's not available generically. So generic substitution, no. You ordered it as a generic and it's not available as a generic. Okay, here's the azithromycin. Azithromycin comes 250 milligram tablets. You take 2 tablets the first day and you take 1 tablet the next 4 days. So this is typically a Z-pack, so it's 6 tablets total. You could have ordered it written this way: take 2 tablets PO once on the first day, followed by 1 tab PO daily for 4 days. I mean, that's okay. Some of you had 500 milligrams for 3 days, and I don't know where you got that. I looked in UpToDate, both under azithromycin as the drug, and for COPD, it definitely gives it the 250, the Z-pack basically. And if you look under COPD exacerbation, it gives the Z-pack also. So I'm not sure where that 500 milligrams for 3 days came from. And by the way, azithromycin also has an anti-inflammatory property to it. That's why it works well with COPD. So with this one, it's do not refill. And my prescriptions where I work, you put refill blank times, you put 0 there because mine doesn't have a do not refill. So you have to look at what your prescriptions say also. And this one's, you ordered it as a generic, and it is a generic, so just leave it blank because we're not substituting the generic. We've ordered it, it is it. And child-proof container, I put no. There's no small children, I'm assuming, in this home. And anything with a cap should have a child-proof container if there's children in the home. But this, the Z-pack usually comes as a pack. It's usually a paper pack, and it tells, has the 2 tablets on day 1, and then the 1 tablet on the other days. Okay, here's prednisone. The patient should have been put on prednisone. It's 20 milligram tablets. It's not available as 40 milligrams. So they need to take 2 tablets for 5 days and number 10. Now, all the prescriptions should have a minimum of 3 lines. The drug on top and the available dosage, okay? And make sure that you know if it's a tablet versus a capsule. The next line should be how they should take it, and the third line is how it's dispensed. Now this one I did give some extra information take in the morning with food. If they take it too late at night, they'll be up all night, and it really does rip up their stomachs. So do not refill. It's ordered as a generic and available as a generic, so I left it blank, and childproof container because she's elderly. I said no. All right, somebody asked me about how to order the Chantix or the varenicline. Chantix has a starting pack. So this is the starting pack and how to take it. And then you'd only dispense one starting pack. And then after that, you'd have to do the continuing month pack. So it is not available as a generic. So we do not want a generic substitution. You could leave that blank also because it's not available as a generic, so you can leave that blank. And it's a pack, so that's why I left the childproof container. It's a pack, and you can't do anything about that either. Okay, so to get these 4 points back, redo the prescriptions only. Now, I do want you to do the right prescription. So this patient needs to be on Alaba the first time, when she comes in, and prednisone for sure. I would go ahead and give the azithromycin, but that's up to you. The second time she comes in, she needs the Lama Laba ICS, which is the trilogy. And then if you didn't give her the azithromycin at the first visit, you can give it to her now. So you need these prescriptions. And there's a drop box in module 6 and 7 to do this, so you can get these 4 points back. All right, and then for the rest of the module, there is another case study due at the end of week 7. So this is a 2-week module. There's 2 quizzes for this module, but they're both due on the last day of week 7. There's an antihypertensive concept lab in Shadow Health. And then note that there's very important drugs during these 2 weeks. In addition, hopefully yet on Tuesday, today, I will update the PowerPoint handouts with the little stars to show you which slides have some test questions on them specifically. This is to try to help you narrow in on what you need to know. But with this module, with these heart drugs, I use these every single day. So you really need to know them. Okay, see you next week.